So the therapeutic alliance basically dictates or determines how well therapy is going to work. And this is one of those, I guess, mysterious human ingredients of psychotherapy. It's a relationship that is either there or it's not. Usually, sometimes a very skilled therapist can relate to people very well and is really good at fostering this sense of trust. Most therapists are eclectic in the sense that they are combining elements and different therapeutic techniques. Much as this woman is trying on new shoes, a therapist can try on new techniques and can use them and can find techniques that are going to work. In terms of psychotherapy, language and cultural variables, as well as social class and nonverbal cues, can be difficult for a therapist. A therapist needs to be aware of counseling across cultural, different cross-cultural backgrounds. Cybertherapy or online therapy is becoming very prominent, especially now in the days of global pandemics. We are seeing therapists trying to maintain their current client base through teletherapy, teleconferencing software platforms like Zoom. But in terms of cybertherapy, we're not really talking about using technology to see existing clients. The traditional cybertherapy model was, you're building your clientele exclusively online, and you may be treating them across state lines. And to be quite specific, my license as a licensed therapist extends only to my state. So if I'm licensed in the state of Mississippi, yet I'm counseling someone in Tennessee, depending on where the client is. So if the client is in Mississippi, then I'm covered under my state statute. If I am counseling someone who is in Tennessee, then I need to be licensed in Tennessee. To get around this, a lot of therapists have begun something called coaching. So life coaching. A life coach is a person that is not bound to state licensing credentials, but also there's not a licensing body or a master's degree in life coaching. There can be life coach training programs. So these waters have been kind of muddied, if you will, but the cost involved, well, it's the cost of an internet connection, right? It's the cost of the therapist's time, and they may or may not have different rate schedule depending on whether it's online. But some disadvantages, perhaps there's lack of body language cue that I can pick up. But regardless, cybertherapy and therapy via teleconferencing software is not going anywhere. Moving to biomedical therapies. A biomedical therapy is a therapy that affects biological functioning of the body and brain. So psychopharmacology is the area that we're discussing. It's the use of drugs to relieve symptoms and disorders. As I said earlier, psychopharmacology, there have been studies that medication used to treat bipolar disorder work best in conjunction with a full treatment plan that would include therapy. I'm going to show you just some different types of psychopharmacology, some types of medicines, different classifications that treat different psychological problems. So we have antipsychotic drugs that would treat psychotic symptoms. You would see this with different forms of schizophrenia. We have your anxiolytics. These are anti-anxiety medications that calm the anxiety reaction Anti-manic drugs would treat folks that are bipolar, that are, when they're elevated, these drugs would bring them down. Antidepressants would bring people up in terms of their mood. Selective serotonin reuptake inhibitors, which I discuss often in my class, they block the reuptake of the neurotransmitter selective. They block the reuptake of serotonin selectively, I'll say that. So not all serotonin in the brain, but target specific areas that elevate mood. Other classifications of antidepressants would include the MAOIs as well as the tricyclics. This would be a good chart for you just to take a picture of. This is the classification on the left: antipsychotic, anti-anxiety, anti-manic, antidepressants, and those three types. And over the far right, you see examples of these. Some of these names you might be familiar with. Valium, Xanax, Ativan, or minor tranquilizers for anxiety. Your antipsychotic medications you might be familiar with. And another biomedical therapy is ECT, or electroconvulsive therapy, or shock treatment, it has been called. But this is where electric current is passed through two electrodes on both sides of the brain. Effectively, one student of mine years ago described this as a hard restart on the brain. This is short term. It relieves symptoms of severe depression. Usually for folks who are so depressed that they are really nonverbal, find it difficult to really communicate with doctors and give input about their treatment. So for one student who was in my class, he talked about shock treatment as, although leaving him with some short-term memory loss and an intense headache, it did elevate his mood so that he could communicate with doctors about the next step of his treatment. Psychosurgery. This is a picture of JFK's sister who was born with mild mental retardation. As recent history as the 1960s and mid-60s, psychosurgery, brain surgery, removing of part of the frontal lobe was considered cutting-edge technology by many so-called experts. And it shows you how far we've come in a short amount of time. Now we can look inside of a person's brain through technology, computer imaging. This technology was not in existence at the time of this very tragic photo. So this is a picture of JK's father who consented treatment for his daughter, and after removing a part of her frontal lobe, which we now know, I mean, the frontal lobe is responsible for personality, but it's not necessarily the chief reason why people are mentally retarded. It's not at all. And so removal of a big piece of the frontal lobe was really a bad move, and it reduced her IQ significantly. She would eventually be moved to Arizona, where she remained till her death. Kind of a sad story. So the prefrontal lobotomy is not really seen as a panacea, a cure-all anymore. In fact, it's very rarely done. And we can do so much more now with medicine without invasive surgeries. We do still see some deep lesioning with severe depression and bipolar disorder, but probably the most common treatment, less invasive treatments, psychopharmacology, some psychotherapy, and going from there. All right, I hope this has been informative. And I look forward to hearing about your personal experience with mental health issues. This could be as simple as having friends who were thinking about suicide, talking about suicide, friends maybe not interested in counseling at all. So I'd just be interested to find out what you think about these kind of topics. All right, look forward to seeing your responses online.